When it comes to surgical lighting, clarity and precision matter. The right light source doesn't just improve visibility, it can directly impact surgical outcomes, staff comfort, and patient safety. Two of the most common options in today's OR are Xenon and LED light sources. Both are widely used, but they work in different ways. Xenon lighting produces a bright white light that closely matches natural daylight. It's known for its high intensity and crisp color accuracy, which helps surgeons clearly see subtle details in tissues during procedures. Xenon systems are often preferred for cases where maximum brightness is needed. However, they generate more heat and typically require more frequent bulb replacements, usually between 500 to 1,000. LED lighting is a cooler, more energy-efficient option. LEDs stay cool to the touch and have a longer lifespan, often 10,000 to 25,000 hours, and require less maintenance. Recent advancements have improved LED brightness and color accuracy, with CRI levels now approaching Xenon quality. LED systems also distribute light more evenly, reducing shadows in the surgical field. When choosing between Xenon and LED, it really comes down to your team's needs and preferences. Some facilities prioritize maximum brightness, while others prefer efficiency, longer lifespan, and cooler operating temperatures. Both technologies offer unique advantages. It's about finding what works best for your surgical environment. For a full breakdown of Xenon versus LED, check out the detailed comparison on our blog. To request a quote or to learn more, visit aamedicalstore.com. And don't forget to subscribe for more surgical equipment guides and how-to videos. Thank you!